Hi everyone, it's Paul Muench, and we are in sunny Phoenix, Arizona, where we own and operate Gentle Turns Transportation. And today I just wanted to show you a few things, show you one of our vehicles and how it works and how it operates, and give you an idea of what our non-emergent medical transportation services provide. Again, I want to show you one of our vans here at Gentle Turns Transportation in Phoenix, Arizona. And this is one of the vans in our fleet, and I just want to show you how we operate with all of our vans are equipped to support wheelchair transportation. And you can see we've positioned a wheelchair inside the vehicle. We can actually put two in if we need to. So we use the Q-Strength system to lock the chair to the floor of the vehicle. You can see two on the front, and there's two in the back as well, pulling and the chair in both directions to make sure that it doesn't move when we're driving. One of the key features of this is they have these wings on the side of the housing, and if you click that and you turn that, you hear the click. That's actually tightening up the belt that's inside of this housing so that the chair won't move when we're driving down the road. So I'll walk you around to the back of the vehicle. You can see all of our vans are equipped with the fold down ramp in the back. It's a manual ramp, and it's easily folding down. So we have, you can see again the Q-strengths on the behind the chair, and then we also use a seat belt here to make sure our passengers are safe and secure. You can see that one's hooked on the post there. We just come and hook on the post here, and to make sure that our passengers are secure while we transport. And we cover the whole Phoenix Valley, and I'm very happy to be able to provide this non-emergent medical transportation here in Phoenix.
James and Jing here with Duet. We're an NEMT dispatching software company, and we're really excited to have Paul here joining us. Paul's a really impressive NEMT owner. You know, he's gone from 0 vehicles to 5 vehicles in like less than a year. He's here to tell us all about his journey. And he comes in with a lot of experience. You know, he worked on the broker side before getting into the service side. So we're really excited, Paul, to get to know you a little bit and hear sort of how you've gotten to where you are today in such a short amount of time. So I wonder if you could kick us off by just telling us a little bit about sort of, you know, how that journey started out for you and sort of why you decided to start a service in the first place.
Sure. Yeah, happy to. Hi, James and Jane. Great to see you. So Paul Muench. I am owner and CEO and operator of Gentle Turns Transportation, Phoenix, Arizona. And my background is in healthcare. I've been in healthcare for well over 30 years, but mostly on the administrative side. I have an accounting degree, so I've worked for large payers in managing insurance. And then, as you mentioned, James, most recently I was working with a broker in California as their CFO, and that job was going great. But I sort of got the idea that, maybe I could just build this at Phoenix. And so for personal reasons, it made sense for my wife and I to be in Phoenix. And so we started our business and running our first van in January of 2024.
Wow, that's fantastic. Um, I guess what did you see in your broker work that made you decide it was time to build your own service?
Yeah, and mostly what I was what I enjoyed was the service aspect of this, and that is um, filling a need, a very large need for people who, especially in our case, we're focused a lot on senior population, which makes sense in the Phoenix market. Just knowing that there's a very large need for people who need to get to their doctor's appointments. 90% of our clientele is in a wheelchair, and so all of our vans are wheelchair equipped. And so it was really about filling that need from a service standpoint. And then to further that, I guess my father-in-law, who lives here in Tucson in an assisted living home, has his own challenges in getting around. He can't drive. So we had sort of a personal impact on that as well that fed right into the service aspect.
That makes total sense. Jing and I actually both had family members who used NEMT, and that's how we kind of like learned about the industry and got excited about building in it. So that's very cool. So I'm always, I browse the NEMT Facebook groups and I see, the 15 things you need to do to start an NEMT service. And I never know how much to believe those. I'm curious, what you felt were the most important steps you had to go through to actually, go from 0 to 1 vehicles.
Yeah, really good question. And I struggled a lot with that myself too, as is the case in most situations. The hardest part is just getting started, right? But um, I wrestled a lot with funding to try and figure out where am I going to get funding from, and gee, how many vehicles do I want to get started? So, eventually, I just I took some advice from a good friend who said, gee, I think you should just get started, buy a vehicle and get started. Well, which is kind of what we did. But to get out the gate, of course, you've got to make sure you have the right vehicle for the services that you intend to provide. And for us, wheelchair was really important. So we needed to get a van that was wheelchair equipped. Um, Insurance is a very important part of it. There's, in any business, there's ways to cut corners, but you can't cut corners on insurance. You have to have the best insurance, and it's not inexpensive. The insurance is one of our biggest expenses that we do for good reason, because we're transporting people that we need to make sure they're safe. We also are insuring our drivers and, of course, the vehicle as well. So um, there's that. Understanding the market, really doing research on the
And
market.
actually, let me dig in a little bit on the insurance side because that's a question I often hear from new service providers. Tell me more about sort of why you went with it sounds like the sort of fuller, more complete, higher end insurance instead of sort of the absolute bare bones requirement.
Yeah, well, a couple of reasons. One is in case we ever want to do contracts with hospitals or with government entities, they have requirements for what level of insurance coverage that you have. So we would need to be able to meet those requirements, of course, at a minimum. Um, and also, the drivers that we're hiring, we're hiring a little bit of a higher level of a driver. We're paying slightly more than a market rate for our driver, because we want to make sure that we're providing top level service. And the way part of what we say, what we're doing is it's a white glove service at an affordable price. And to attract the right driver for that, we need to make sure that they're covered for insurance. And so all of our drivers are first aid and CPR certified. They have a clean driving record, and they have some kind of reason why they want to be connected to this community in providing that service. The insurance part is important to them, and it's important to us to make sure there's good coverage for that. We do have professional liability insurance, as I may have mentioned, for all of our drivers, just in case something happens, and in case there's some kind of a dispute. We make sure that we're covered for that.
That's really important. And yeah, I hadn't thought about it before, but I can see why a really good driver who's in demand would want that kind of coverage.
That's right.
Yeah. So on the insurance side, Paul, can you comment on the service levels impact on insurance? For instance, stretchers or gurneys versus wheelchairs versus ambulatory? Because we always hear some providers say, "Hey, my drivers cannot help patient from the couch to the wheelchairs. They can only take this patient when they are already in the wheelchairs. So because of insurance constraints." So can you comment on that?
Yeah, that's a very, very important question, Jing, and I'm glad you brought it up. So the service levels that we're providing, we provide ambulatory services, for people who walk. We provide wheelchair, and as I mentioned before, that's the biggest volume of percentage-wise, the biggest volume. We do provide gurney transportation as well, and we have a great chair that is a convertible chair from a wheelchair into a stretcher. It's called the Broda Traverse chair, and it's an amazing chair. Anyway, that's what allows us to be able to do the gurney transports. But the question that you ask about transportation or transport versus transfer, two very different topics. And the truth is, the insurance that we carry does not cover us for transferring people into a chair or a gurney. So we say to our drivers, it's very important to make sure that when we're at a facility or somewhere where there is a transfer required out of a hospital bed or out of their own chair into our chair, that has to be done by the caregivers or family members. Now, we'll assist. We have no problem assisting, but the direction has to be given by the caregivers. And I make it very clear that the caregivers are the ones that are leading the charge in that transfer, which to your point, Jing, is very different than the transportation.
Great to know. Actually, it can be done using broader chairs with this level of insurance because the caretakers, the nurses at the hospitals or facilities can help with the transfer. I think this is
Yeah, and what
really
I've found that most of them clearly understand that. I've never run into a situation where there's a dispute about who's in charge of that transfer. So it's pretty well known in the industry, but it is a very important topic, and our drivers have to be trained very well on that.
Yeah. On that subject, is there anything else that, you feel a new service provider might not know, that, you would like to tell your past self, when you were getting started?
Well, yeah, there's all kinds of tips and tricks that have come along with the experience that I've gained, and some of those are little things. They're little nuances with the Q strength system, for example, which, by the way, is a great system for locking down the chairs and the gurney inside the vehicle. Absolutely essential. And so, there's a couple of ways that you can make sure that the chair, because when you're using that Q strength system, I'll just give you an example. It has two straps in the front of the chair and two straps at the back, so they're tugging against each other, which is by design so that the chair does not move when you're in transport. Well, when you're hooking that up, there's a right way to do that, and there's good training videos on that. There is a way to actually tighten the housing on the Q strength system because the strap itself is a little bit loose inside of that housing. So there are cranks or dials on the outside of that if you turn it one or two clicks, it takes up that slack. So then that chair won't move at all. And what I have found, if you don't do that, the chair will move maybe an inch or two, which is really not terrible, but it's a little alarming
Hmm.
to the
I'd be a
people.
little alarmed.
You might understand why. I think I'd be alarmed too if I were sitting in a chair and it was actually moving a little bit. So, and it's alarming to me as a driver if I hear that
Hmm.
because the last thing I don't want that chair moving at all. So
Hmm.
that's just one of the things that I have found is important and that you can actually do with the Q strength system.
That's a great point. What did you feel like was the hardest challenge to overcome when going from 0 to 1?
Yeah, probably just getting the volume to get started.
Mm.
As in any business, you have to figure out who's your market and how are you going to reach that market. And so it took me a few months of going out and meeting people that are in the industry, letting them know that I'm now operating in the area and want to provide service. It takes a little bit to get started that way, and then once you do that, the word of mouth is really strong. You gain a reputation, which obviously is very, very important. And it just takes some patience to get that off the ground and get it moving, and a lot of perseverance. And what I found was after about 4 or 5 months, the phones really started ringing, and then people start talking with each other, and the the visibility in the market started to really happen, and then it's really taken off from there. So getting started was the challenging part, and just knowing that it is going to take a little time because there's obviously competition in the industry, and these services are currently being provided. It's a matter of stepping into putting your toe in the water and getting known for providing top quality service.
so. Any specific things you do? So because it takes like 4 or 5 months. So did you do anything like what did you do in this 4 or 5 months to
Sure.
drive drama?
Yeah. I happen to like networking. That's something I enjoy doing. So I have joined a few networking groups in the area, specifically focused on senior community and providing healthcare services to the senior community. Um, there are placement agents that are really critical to helping seniors to find the right assisted living setting. And there's an association for the placement agents, and I joined that group, and they have been very, very helpful. So I've met a lot of those placement agents that are busy doing the matchmaking for those assisted living homes. They have really introduced me to a lot of great clients. And then I've also gotten a chance to meet the assisted living homeowners, which has been obviously very important as well. And that's our niche. That's really kind of where we're focused on. And it seems to have come together well.
Did you pick that niche deliberately at the start, or did you just go out and do things and kind of see what sticks?
Yeah, no, I did. Yeah, good question, James. But I really did pick that niche because, again, mostly we wanted to provide a service. And by the way, that's where our name comes from. The Gentle Turns name started with doing a good turn, doing someone a good turn, a good service. And then because we're doing it for seniors, we decided to call it Gentle Turns. And so it really has been from the beginning focused on seniors. Now we'll provide services for anyone who needs it, but most of our clientele are seniors and most of them are going to doctor's appointments. I also say, it doesn't have to just be medical services. I take folks to weddings, to funerals. I've taken them to family events. I drive on holidays, Christmas and Easter, because I want to make sure people can get to the events that are important to them.
That's really nice. And when setting up, how did you figure out pricing? That's a question I often hear, come up with newer services.
Yeah, another challenging question, and that was, it was important to be able to come up with a competitive price, but make sure that we're not pricing ourselves out of the market.
Hmm.
So honestly, I'm still kind of working on that a little bit, and I feel okay about the pricing that we're using. But we get feedback on both ends of that. Some folks are surprised at how high the price is, but most folks are happy with it. And what I have found is if you're providing a quality, reliable, respectful service, people are happy to pay for that. And so, yeah, the pricing is still a little bit of a challenge for me, but I feel pretty good that we're positioned appropriately in this market for that.
Hmm. Did you do any promotions when you were starting out, like a discounted price for the first 3 months or something?
We did a little bit of that, yes, especially for assisted living homeowners, because if I'm asking them to make a change from their current service clientele, then I want to try and give them an incentive to at least give us a try.
Mm.
So yeah, we did a lot of half price rides or even deeply discounted rides for purposes of marketing, so that we could just have a chance to be able to show the services that we're providing.
Hmm.
And
And
certain markets are more responsive to that than others. And when I say that, the Phoenix market it's one huge big market, but inside of that are all these different pockets of cities that frankly are a little different to operate services in. So and it is a big valley. It's about a 50-mile radius here. So we cover a lot of ground because we say we go all the way and we're covering the whole service area here in Phoenix.
I have to say, I mean, you've made sort of a clean break from the broker side to the business side. From what I understand, you don't work with brokers. Could you tell me sort of why that is?
Yeah, we haven't worked with brokers, although we're starting to maybe consider doing that. I like the idea of being able to support a broker relationship. However, I have to just make sure that economically that makes sense. So in many cases, when you're working with a broker, then there's some chunk of the revenue that you have to give up on. So we evaluate that, and if it makes sense for us, and if it's okay to do that, then we're happy to do it because we do like the volume. But those are things that's one of the reasons. I mean, it took a little bit longer out the gate to get started since we weren't using brokers, but I feel good about the relationships that has allowed us to generate. So it continues to grow.
Great. So now I want to, talk a little bit, okay, you've got your vehicle, maybe it's a couple months in, you're starting to feel like the phones are ringing, you're hitting your stride. What have you done since then to sort of continue to, develop business, to get more riders? What's your approach been?
Yeah, a couple of key things. We have advertised in a couple of different magazines that are
Mm,
local to the area, and mostly, I think the biggest thing that we've done is we've utilized a Google ad campaign, and so um, that's been highly effective, and it allows us to be able to reach the target that we're searching for. Frankly, I was a little surprised because the talented lady who's helping us with that, I said to her, I said, I really don't think people are online, looking for these kinds of services. And she said, yeah, they are. In fact, I can show you that they are. And she was right. And she is right. So we continue to have some success through that Google ad campaign. And the numbers are still a little surprising to me about what the percentage of new users are. So, this is there's a lot of challenge for people going through the aging process, and especially for their family members, because many times when we're talking about services, we're not necessarily talking with the individual that we're providing services to. It's their family members.
right.
So it's a big adjustment for them. There's a lot of questions and a lot of concerns, and they're very scared about the changes that are happening with their family. And so that's really one of the things that we're trying to do, is take away any kind of concern about transportation. Because there's plenty of things for them to be concerned about. We want them to not have to worry about transportation.
Yeah, I totally understand. Have you noticed that you're able to, perhaps you're doing a private pay ride or a ride for a family member, and then sort of you use that as leverage into a facility, or you're doing rides for a facility and you use that, leave
Yeah.
your business card with the rider. Could you tell me more about either of those that you've
Yeah,
had?
great marketing opportunities, and we try not to miss those. And but you're right. We go to a place for the first time, um, respectfully, we want to leave our business card or some collateral with them to just let them know that hey, this is what we do, and we'd love to be able to be a provider for them. I'm careful about that because I don't really want to do that in the face of our clients,
Right.
because I always want the client to know that they're number one in my book. And so I find a way to do that when the client isn't really present, so that because that's a separate, I'll call it a transaction more or less, but a separate engagement for me as a marketing opportunity. And I don't want to miss that because that's important. But I'm there to provide a service for our client, and I don't want that to be shortened either.
So that's a bit of a delicate balance, I imagine. How do you sort of find and or train the right drivers that they can execute on that as well as you can?
Yeah, we've been pretty fortunate with that, and we've been very, very selective. Um, there are drivers that have asked if they could come work for us, and we right away want to ask a few questions that will help us to decide if that's a good fit for us to at least move forward in the process. Our ideal candidate is someone who has probably retired, but they want to continue to work some. First responders, military folks who maybe have retired, but they're still young enough that they still want to work. Not a full time role, but they maybe want to work 1 or 2 days a week. And so we have a pool of those kinds of drivers. And again, if they have the right driving record, and if they have the right mentality and respect for people, and an understanding of what we're doing, then we just take them through our training protocol. And the first thing they do is do a ride along. I want them to spend a full day with me when I'm out driving, so they can see this is the level of service that we're providing. These are the expectations about. There's always surprises, right? There's always things that happen that we're not expecting. It's very important that our driver does not indicate a loss of self control. They always have to be respectful, no matter what happens, no matter if other folks are not respectful to them. That's just how we operate our business. And so they need to see that firsthand. And so that's really the first thing that we do, is ask them to do a ride along. And then they can get an idea about whether they think they might like it, and gives them a chance to ask questions. And it works out really well.
That's great. Um, any other tips on the business development side that you found really effective?
Um, I think the other thing I would say is not every marketing opportunity is a good one. So, because there are a lot, folks who will really reach out and want you to spend dollars in a marketing or an advertising sense, and You have to be careful with that because what I always say, and I think all of us are like this, when we're spending money in that realm, you want to be sure there's a return on that. Well, everyone wants that, but the key for me is, how do we measure it? If there has to be a way for me to know that there is a return or that there isn't a return. Even if there's not a return, as long as I can see that and know that, then I can make an informed decision about whether I want to continue it or not. But if there's really no good way to measure it, you don't really know if that's money well spent or not.
How do you typically measure these things?
Well, in terms of the Google ad campaign, I get fantastic reports every month about the volume of people, which people are searching for us, what are they searching for, what service area are they living in. There's a lot of that really, really good reporting that I get from that. Um, then we always ask, whenever someone calls, we always ask, how did you find out about us? And so usually we get pretty good information directly from the user. That's really very helpful for us. And so, those are, some of that is just a discipline about chasing it yourself, and some of it is about healthy data reporting.
Speaking of Google, do you how important do you feel sort of a really strong Google profile is and Google reviews are? Like do you like, chase people down and try to get them to leave you a review? How do you handle that?
Yeah, you're asking all the right questions, James. And, that really is a very important, and that takes time. And we do ask people to do reviews. In fact, some people who wish to give us a tip, I always ask them, we really don't want our drivers accepting tips. But the best way to, if they really felt good about the service, the best tip they can give us is to do a review for us. So people are happy to do that. And so, yeah, we've been very fortunate. We have over 40 5-star reviews now on our Google page, which then, as you said, gives us a little bit of status on the page itself. So that's helpful.
Mhm. Great. And do you find other sources like Yelp or do they still have the yellow pages? Like, do you find people coming in from other sources as well, or is it mostly Google?
Mostly Google, Yelp. There are some that come through Yelp as well, but yeah, it's generally an electronic. Uh, Now, our vans all have marketing on the vans. Of course, they're all wrapped with our name and with a phone number. On rare occasion, we will get somebody that calls and says, "Oh, I saw your van sitting at a doctor's office, and I was curious about it." So that does help itself too, but that's certainly not as common as people going online.
Yeah, actually, Paul, I noticed that you have really good website. You're like, I really like your website. So is that something have to do with the digital marketing you?
Yeah, yeah. Thanks, Jing. I appreciate that, and that was done through a relationship with the same talented lady who's helping me with my Google ads. So she started with updating the website because we built our own website to start with. That kind of goes back to the question you asked, James, about how to get started. And we built a website from the beginning, but frankly, it was pretty basic. There weren't a lot of bells and whistles on there. So what you see now is because we hired someone to help us do that. And I think that's absolutely critical.
Great. So I'd like to pivot a little bit now and talk about, again, going from the one vehicle up to the five vehicles. Tell me about sort of the operational challenges, because obviously it's a very different beast when you're in the car driving your one vehicle versus you're managing a small fleet of other people.
Yeah. Yeah. That has been a little bit of a challenge. It's a fun puzzle to put together, but my wife, who is helping me with the business, she and I are co-owners of the business. She handles a lot of the operational part. So she is typically answering the phone when it rings, and she's doing the scheduling, and she's doing the dispatching of all the rides. So she's pretty busy now doing all of that. And I mentioned the model of how we have multiple drivers who are part time. We really like that model, but that creates a little more of a challenge for the dispatching because she needs to know which driver's available on what day and what hours and how that lines up with the schedule. Of course, and the schedule changes all the time. So that's the other thing that we have learned, that we have to be very flexible. Um, because there are times when we have to say no to a potential ride because we have a full schedule, and then someone cancels. So, I mean, that's just part of the business. And so far, we haven't charged a cancellation fee because, we would if we felt like it was a cancellation for no particular reason. But it's always because the doctor, canceled the appointment, or someone is sick, or if there's a good reason for the cancellation, I don't really want to charge people for that. So
Mhm.
it is a challenge to get all of that put together. By the way, we do not utilize a call center, which I think you guys have a way to help with that when we grow. But that is something that as we grow further, um, we'll probably need to engage in a call center relationship. But at the moment, either my wife or I are taking the calls. And we think that's important because, again, there's a level of service, even on the phone call, which is always a first impression that is very, very important.
I think it's so important that, regardless of whether the owner is picking up the phone or someone in a call center or someone sitting in your office is picking up the phone, they really know your service well and they are, doing full-time work for your service. Because that's like the impression they get of you is how you come across over the phone.
Yeah, that's very true. And that kind of comes back to the situation that these folks are in, and they feel kind of like it is a situation, and it's a problem for them to solve, and they need a partner to help them solve. How is my loved one going to get to their appointment when they can't walk? And I can't take them in my car anymore. We've tried that, and gee, the last time they almost fell. And so we love it when we hear of an opportunity to be able to help in that situation, because it really is very, very important. It's a barrier to healthcare if people can't get to their appointments, and so we're happy to be able to help with that.
Hmm. Great. So, as someone who does operations software for NEMT, I'm always really curious about sort of, how people like, oftentimes people are starting off with, Excel, Google Calendar, something like that. I'm curious, Paul, sort of, what system you use to manage your service starting out, and then sort of at what point you felt like you needed something more custom built for NEMT.
Yeah, well, started out really with an Outlook calendar, just putting appointments on the calendar, and pretty simple and basic. We may color code them based on where they might be going, but we've learned a lot through that too, because so many of these appointments are unpredictable in terms of how long they will last. So as we have grown, it's challenging to try and stack rides inside or on top of another. When I say inside of another ride, then there are certain situations. If there's two rides that are very close geographically, we might do a drop off on one and go and do another pickup and drop off before we come back and do the pickup on the first one. That's rare, but there are certain situations where that might make sense. But again, because we are guaranteeing a certain level of service, we have to be really careful about that, because my number one goal is safety. My number two goal is I don't want people waiting, because anyone in this business knows that that's a big challenge, is folks have to wait a long time for their ride to show up. None of us like that, right? Even if we're just waiting for rideshare. So I guarantee that people won't wait more than 15 minutes for their pickup when they're ready. And usually it's less than 10 minutes. So when we take someone into their doctor's appointment, we bring them inside. We want to make sure they get checked in. I'll back up just a little on that, because back to an earlier question you asked about one of the bigger challenges, what I have found is one of the biggest challenges for me as a driver, when I go to a medical office complex, just finding the right door to go into is not easy. There's
Had that challenge as like a patient,
exactly right.
and I
Yes.
can walk.
There's multiple buildings usually. So you got to find the right building, and then you got to find the right door in that building. So that's why that comes back to what we're providing, a white glove service, because we're not just going to drop them at the curb and say, good luck. We actually get them out of the vehicle. We take them in, we help them to get checked in, so we know they're at the right location. and then I'll just hand them my card and ask them to call me when they're finished. I go somewhere, typically to a coffee shop or a lunch spot that's close by, so that if I have my laptop and I've got a Wi-Fi connection, then I might as well be in my office, right? So then I wait for the call and I go back, and it's always within 10 minutes of when they've called. So that's the kind of white glove service that we're providing, and we feel strongly about that.
Yeah, that's like our favorite kind of customer to work with. Paul, obviously I know you because you are a Duet customer. Um, I'm curious, sort of what using Duet, and I'm sure many of these things may be not unique to Duet. There's other good softwares out there. But tell me sort of how adding a NEMT operations software to your business changed how you did things.
Yeah. We love Duet, by the way. And one of the things that I love about it is the the visibility of the schedule. So because that schedule is what's so important, to be able to make sure that you don't overschedule, or that you also don't miss out on an opportunity, because you need to know where your pockets of availability are. And at the same time, just as important, you have to make sure what your limitations are in terms of the schedule. Duet is very good at that. And being able to have a group of drivers like we have, and be able to assign the driver, or the dispatching process, is also something that's very, very, very important, and it's very effective inside of Duet. Uh, we have utilized other software, and as you said, other software is effective as well. Um, I love the way Duet does it, and the real key is being able to have all of that on my laptop, but then getting it over to the phone, because each driver has to have that in their hands when they're out in the field. And that's very seamless with Duet, and it works very well.
Have you felt like, using software has let you sort of fit more rides into your schedule?
Oh, yes, absolutely. Yeah, I do feel that way. And I also have a lot more confidence that we're going to be able to execute on the services that we are promising.
Yeah, sort of the on-time service and the being able to have the vehicle idle less is always good. Do you have, I mean, any
Yes.
sense of sort of what those numbers are like? Like, can you fit, 15% more rides in? Has your on-time rate changed at all?
Yeah, I'd be guessing on that, but um, I would say at least a 10% improvement on the scheduling and availability. Um, our on-time rate, I think, has always been good. So I guess what I would say about that is it hasn't lessened by any measure at all. Uh, so if we've ever struggled with an on-time rate, it's because that we have gotten a little too aggressive in scheduling.
Yeah,
And
it's a trade-off, right? But you can
it is a
raise
trade-off.
one. If you keep one steady and raise the other, that's awesome.
You're right. It's a trade-off, and it's also one that, for me, as the person with the idea and establishing the business, I never want to say no to anything.
Oh yeah, yeah.
Somebody requests a ride, and I want to say yes to it. Well, that's not always the right decision, and my wife is really good about saying, "Hey, I know you want to say yes to this, but take a close look at the schedule, and there really isn't a way to do it." And that's super important, because the last thing I want to do is promise a ride and not be able to deliver it.
Do you have any like partner services that you sort of send overflow rides to?
Yeah, we do. There's a couple of trusted vendors here in the market that I have gotten to know a little bit, and that we have sent some overflow to, and they return that to us as well sometimes. So that's important, because when I recommend another party, then I want to make sure that that my client's gonna be taken care of just like be with me. So that is really important.
Great. Yeah, I always love when I think it helps a lot when you get to know the other, the competition in your area. But often it's like, you have a couple sort of white glove services and a couple sort of, just trying to race to the bottom services. And if you are on the white glove side, you want to make friends with the other
I
guys.
find the other ones that are doing that too. Yeah, that's
Yeah.
very true. And that what I have found is there's plenty of business here in this area. I obviously there is competition, and folks are working hard, and I respect that. So I just want to be able to provide the service that we're doing and continue to grow, partner with the right partners. The other thing that's really important is in this senior industry, there are a lot of other that are important to my clients. So that's the back to the networking part, which is really nice because let's say somebody is in need of hospice services or they need medical equipment. I am now building a strong network of people that I can rely on to provide those services, which aren't what I'm doing, but they're a corollary to what we're doing. I, again, want to make sure that my clients are getting top service.
Yeah, I imagine it's kind of the similar, kind of similar for you. I mean, often we have new services come to us, and like we can provide them software, but I can't set up a Google Ads campaign for them or whatever. So I try to meet other people in the industry and say, oh, go talk to this guy, go talk to that guy, and you just sort of help people get rolling, and then they're bigger customers for us.
Yeah, and I think it generates more trust too
Yeah,
with
yeah.
with our clientele because they know that what we're really interested in is solving whatever needs they have, even if I can't solve that myself.
Hmm. Great. Let's see. So as you've been growing, have you sort of gone for you've picked out your favorite vehicle and you're just buying it over and over again, or have you mixed and matched and changed
Yeah,
your opinions over
it's
time?
evolved a little bit. I like all the vehicles we have. Most of them now are Toyota Siennas,
Uh-huh.
and been very happy with them. They're a comfortable ride. They are a hybrid vehicle, which helps on the gas mileage, and so far their maintenance record has been really solid. So yeah, we really like the Toyota Siennas.
Great. I've heard good things about them.
Yeah, they're a little hard to find because they're a popular vehicle.
Yeah,
So yeah, when it comes time to get a new one, I have to give a little bit of notice and know that it won't be a week. It's probably going to be more like a month before I can get one.
got it. So it sounds like you've got the vehicle plan figured out. Broadly speaking, sort of what's next for you? What's your vision for the service?
Yeah, well, we love operating in the Phoenix market here. Again, it's really the right market to be in for senior services. Um, there's a lot of growth that still happen here in this area. Um, there are pockets of the valley that we have sort of touched on that we want to grow in. As our fleet grows, now it's getting large enough that we can actually position vehicles around the valley so that we can hire drivers in a different location, say on the east side. And with one of my partners, we can park a vehicle there. Our driver can just drive to the vehicle to and from every day and do the rides in that section of
That helps a lot. Yeah.
it helps a lot. Yeah. So it saves a lot of time, it saves some gas, and it allows us to be more efficient in delivering services. So that's we're constantly evolving with that aspect as well. Um, and then the different types of service that we're providing, it's been fairly basic, but there's always more and more services that we can provide for people that need it. We can do airport rides. I tell people, we'll take them to a concert or even go to a casino. I mean, I'm really trying to just make sure that people can maintain a lifestyle that they want to have and that they may feel like they have to give up because they can't drive anymore. And we're here to help with that.
Well, fantastic. This has been really, really insightful, even for me, having spent quite a bit of time in the industry. Um, any other sort of tips or topics we haven't touched on that you'd like to mention that you think might be helpful to people?
Well, here's something that surprised me. I knew I would like doing this, but I'm just amazed at the people that I get to meet. And every one of us, this broad cross section of our people that live in our country, um, they all have a story. And in general, I feel like our society has sort of kind of forgotten about seniors a little bit. And so I get to help with that. I get to show them that I care. I listen. For those that are willing to talk, I love to talk. I love to hear their stories. And the people that I've had a chance to
My,
meet,
my grandmother would really like you, Paul.
well, I get that from my dad. My dad was a very good social communicator. And that's part of the job that I love. And again, it's just people that when you do genuinely care, it shows, and people like that. They like to be listened to, and so it's usually just a short ride, but we get a chance to show that we care. For those people that we are doing multiple rides for, we get to know them a little bit, and we care about them. We're doing dialysis patients. We're taking people back and forth to their cancer treatment. Could be anything, but it's usually something that's a challenging time for them. And so we're happy to be able to help with that.
Well, that's a fantastic way to end. Paul, thank you so much for coming on, and excited to continue working with you as you grow.
Well, thank you, James, and thank you, Jing. I'm very excited about our partnership with Duet. A lot of growth that we're going to see and that you are experiencing on your end too. And so I really appreciate what you're doing and helping us to be able to be efficient and providing the services that we're wanting to do.